Right, so today we're really going to dig into this 10-bed ICU program they've got going on in India. You sent over a ton of info on this, so, well, we've got our work cut out for us. Let's see if we can figure out what this thing is all about, backstory, the impact, all of it.
Yeah, and you know what's wild is this whole thing, it came out of like a crazy intense situation.
Yeah.
Back in April 2021, India's second COVID wave, they had like, I'm talking 7 million cases a month.
7 million. Yeah, wow. I mean, now that you mention it, that was a pretty scary time just seeing that on the
Oh, it
news.
was. It was a big deal. And that's really where 10-bed ICU got its start. Like they kicked it off just beforehand, March 2021, right as that wave was building,
Yeah.
because there just weren't enough ICUs, especially out in the rural areas, which were already stretched thin.
So it was a real we got to do something now kind of moment.
Exactly. And they went all in with this five-pronged approach,
Yeah.
which I think is what makes this program so interesting.
5 prongs, huh? All right, you got me hooked. Lay it on me.
Okay, so first you got to understand this 10-bed ICU thing, it's a public-private partnership. They're working within existing government hospitals, which makes sense. Those are often the only option in more rural communities. And we're talking 9 states in India.
9.
Wow, 9 states. Talk about ambitious. So how do they even begin to do that?
Well, first things first, you need the right tools, right? So they focused on providing state-of-the-art equipment. Like, we're talking ventilators, defibrillators, infusion pumps, patient monitors, the works, anything a modern ICU would need. But here's the kicker. They include a 3-year warranty on all of it.
Oh, wow. See, that's huge. Because what good is giving someone a new MRI machine if it breaks down in a year, right?
Exactly. They're thinking long term. This isn't a Band-Aid solution, but equipment's just the start. Second prong technology, this is where things get really interesting. They developed this software platform called Carry. Award-winning, by the way. It's like the brains of the whole operation. Yeah. I actually took a look at some of the diagrams for this care platform, and it's really remarkable how comprehensive it is. It's electronic medical records, pandemic management. They've even got tele-ICU built right in.
It's true, and that's what's so cool about it. It connects everyone, patients, facilities, healthcare providers, all on the same system. And it's all in real time, so everyone's working with the most up-to-date info.
So theoretically, you could have a doctor in Mumbai looking at the same information as a nurse in a rural clinic hundreds of miles away.
That's the idea. It's like having everyone under one roof, even if they're miles apart.
That's amazing. Okay, that makes a lot of sense. So we've got the physical ICUs, the equipment, and this really incredible software. What's a third prong?
Right, so the third prong is where we really start to see this vision come together. This is tele-ICU. Remember how we were talking about the lack of specialists in rural areas? Yeah. This is how they're tackling that. They use this hub-and-spoke model where you've got specialists at these big medical colleges, the hubs, and they're connected to the more remote 10-bed ICU hospitals. Those are the spokes.
So it's like they're creating this network of medical expertise emanating from these urban centers.
Exactly. And the Mysore cluster in Karnataka is a perfect example. They've got KR Hospital, which is part of Mysore Medical College, and that's a hub providing specialized care to a bunch of smaller hospitals in the surrounding areas.
I'm guessing that requires a pretty serious tech setup on both ends.
Oh, absolutely. And they've really gone all out. So at the spokes, the rural 10-bed ICU sites, they've got high-resolution cameras, laptops, workstations, even software that pulls all the data from different patient monitors into one place. And then at the hubs, they've got these large 4K TVs, more workstations, printers, even backup power. They've really thought of everything they'd need to effectively monitor and interact with these remote ICUs.
So it's not just a video call. It's like being right there in the room.
Yep, that's the goal. And they've really gone the extra mile to make it happen. Of course, even with the best technology in the world, it's only as good as the people using it, right?
Right. So I'm going to guess prong number 4 is training.
Bingo. And they haven't skipped on it. They offer basic and advanced life support training, plus instruction on how to use all the equipment and the Carry software naturally.
Well, yeah, you can give someone the most advanced medical tools in the world, but they're useless if you don't know how to use them.
Exactly. And they've even incorporated AI into the mix, which is really cool. They developed this AI tool called the Ayushman Nurse AI tool to specifically help nurses with their training and development.
Hold on, an AI tool for nurses? What does that even look like?
It's pretty neat, actually. It brings together all these different things: reference texts, AI-generated answers based on the latest medical knowledge, and even a panel of expert reviewers, all to provide these nurses with really personalized training and support. It's like they can literally ask the AI a question and get feedback in real time.
That's so much better than just handing someone a textbook and saying good luck. It sounds like they're really committed to making sure that people using this technology are well equipped to do so. Okay, so I've got the equipment, the technology, tele-ICU, the training. What's the fifth and final prong?
The fifth prong is really what I think makes this whole thing sustainable. Community participation. They work with local communities to create these groups called Rogi Kalyan Samitis, RKS for short.
RKS. I feel like I've heard that before, but I'm blanking a little.
Basically, they're like these community-led committees that act as a bridge between the 10-bed ACU project and the communities they're serving. They do a little bit of everything: fundraising, patient advocacy, making sure the quality of care stays high.
So it's not just a matter of showing up with fancy technology. It's about making sure the community has ownership of it.
That's exactly it. They really get that for this type of program to work long-term, it needs that buy-in from the ground up.
I love that. It's a very holistic approach. You can tell a lot of thought went into this. But before we move on, can we circle back to the CARE platform for a second? Because I feel like we've only scratched the surface of what it can do.
Oh, definitely. There's a lot to unpack there.
So we talked about how it connects everyone, how it provides real-time information, but like, what kind of information are we talking about? Get into the weeds a little.
Okay, so for one thing, it gives healthcare workers this really comprehensive overview of all their patients. Like, for a given hospital or even across the entire state, they can track each patient's status, see who needs immediate attention. It's all right there.
Wow, that's got to be crucial, especially for prioritizing care, especially in an emergency.
For sure. And if you look at a sample patient record, you can really see how detailed it is. Demographics, vital signs, medical history, what medications they're on, allergies, diagnoses. It paints this incredibly detailed picture of a patient's medical journey.
So no more digging through file cabinets trying to track down paper records.
Nope. It's all digital, accessible, and organized.
And don't forget about those high-resolution cameras we were talking about earlier. The fact that you can visually assess a patient remotely, like even zoom in on their face or specific monitors, that's huge for specialists trying to give care from a distance.
Absolutely. And here's the thing. CARE isn't just some glorified database or communication tool. It's intelligent. Remember we talked about AI.
You mentioned it analyzes data and integrates it into the electronic medical records, right?
Yeah, it takes all that raw data spitting out of the patient monitors and automatically integrates it into the EMR so no one has to manually enter it. That alone saves a ton of time and reduces errors, and it lets the healthcare workers focus on what matters: the patient.
It's like having a digital assistant working behind the scenes, making sure all the information is accurate and up to date. But wait, there's more, right? Didn't you say something about discharge summaries?
Oh, right. CARE also uses this thing called multi-pass summarization to generate these crazy accurate discharge summaries. So patients are sent home with these clear, concise summaries of their treatment and what to do next. It just makes that transition back home so much smoother.
So it's streamlining a lot of these tedious, time-consuming tasks that doctors and nurses usually have to deal with, frees them up to actually spend time with their patients.
Precisely. And it gets even better. CARE is designed to integrate seamlessly with the thing called the Ayushman Bharat Digital Mission, ABDM. Basically, it's India's national digital health ecosystem.
Oh yeah, that was actually something I wanted to ask you about, because that seems like a massive step towards creating a truly connected healthcare system. How does that actually work on a practical level?
It's pretty slick. First, it allows everyone in the system to get an ABHA number, which is like a unique health ID. Then, using something called a Health Information Provider, or HIP, they can share digital health records securely.
Wait, so patients can actually access their own health records from anywhere?
That's right, with their consent, of course. They use a Health Information User, or HIU. Gives them so much more control over their own healthcare information.
That's amazing. Gives patients the power to be active participants in their own healthcare. What about insurance? Because I know that can be a huge barrier to access.
For sure. And that's another thing the ABDM integration helps with. Streamlines the whole health insurance claim process using a health claims exchange, or HCX.
So instead of dealing with a mountain of paperwork, they can just submit everything electronically.
Exactly. Less paperwork, fewer delays. The whole process is just so much more efficient.
It's starting to sound like the healthcare system of the future.
It's definitely a step in the right direction, and the National Health Authority seems to agree. They've officially certified the CARE platform in 6 of the project states.
6 states have signed off on it. That's huge. Which ones are we talking about?
Let's see. So far, it's Sikkim, Karnataka, Assam, Manipur, Meghalaya, and Nagaland.
Wow. So they're meeting, maybe even exceeding, national standards for data security and interoperability, which, let's be real, when you're dealing with sensitive medical information, that's a must.
Absolutely. It really speaks to how much effort they've put into building a truly trustworthy system.
Okay, so we've got this amazing technology, this really ambitious vision. It's getting official recognition. But what does it all mean on the ground? What's the actual impact been like so far?
Well, that's the million-dollar question, isn't it? And the results, they speak for themselves. They've already set up 206 10-bed ICUs and 14 tele-ICU hubs across 9 states.
206. Wow. Okay, that's way more than I was picturing. Any chance you know the breakdown by state?
Let me see. Assam has 37 units, System's got 5, Nagaland 12, Manipur 16, Meghalaya 14, Puducherry 5, Karnataka 43, Andhra Pradesh 36, and Telangana has 40.
Those are some impressive numbers. But numbers only tell part of the story. What does this actually look like for the people this was designed to help?
That's right. It's about more than just statistics. Remember the whole shortage of specialists thing, especially at those smaller hospitals.
Yeah, the Toluca hospitals, right. Actually, what does Toluca even mean?
Oh, good question. They're basically these smaller, often rural hospitals that act as the first point of contact for a lot of folks. Might not have all the specialized equipment or personnel of a larger hospital.
So the tele-ICU part is bridging that gap, connecting these Toluca hospitals with specialists at those bigger centers.
Exactly. And we're not just talking about hypothetical benefits here. Like, there are real doctors, real people who've shared just how transformative this program has been.
Like Dr. Bino Ningthujam, who's a senior specialist at Bishnupur District Hospital in Manipur. He's talked about how much the 10-bed ICU training has helped him and his staff.
And Dr. Ayushi Tandon, she's a professor at Mahindra University. She's been super vocal about the positive impact on patient care.
Yeah, it's those personal stories that really bring it all home. It's not just about the technology or the numbers. It's about people's lives being saved, being improved.
100%. And that's what makes this so inspiring to me. They saw a really complex problem, a lack of access to critical care, and came up with a solution that's not just effective, but compassionate.
It makes you wonder if this could be a model for other parts of the world dealing with similar issues. Lack of healthcare access isn't unique to India.
Such a good question, and one we should definitely dive into more.
Hmm.
There's huge potential here to transform healthcare in India and beyond. But before we go global, I think it's worth looking at some of the more remarkable parts of this program.
Yes, let's do that. Because the more we learn about 10-bed ICU, the more impressed I am.
It really is incredible when you think about it, right? It's not just about, treating the patients. It sets off this ripple effect.
Right, because when people have access to healthcare, good healthcare, it's not just them, it's their families, their communities. It affects everything, even like their ability to just earn a living.
Absolutely. It's a huge driver for social change,
Yeah.
you know?
Yeah, for sure. And the fact that they're combining that with like all this cutting edge technology and AI, it feels like we're seeing the future of healthcare being invented right in front of us.
It really is incredible what they've accomplished in such a short time. But got to remember, technology is just a tool at the end of the day, right?
Mm.
The real story here, the real heroes are those healthcare workers, the doctors, the nurses, the support staff, everyone making this actually happen.
100%. And that brings us back to something we talked about earlier, community participation. Because you can't just like show up with a truckload of gadgets and expect things to change, right? The
Yeah.
community needs to own it.
Exactly. And that's where those RKS committees, those Rogi Kalyan Samithas, they really come in. They're the ones making sure that 10-bed ICU isn't just some temporary fix. They want it to really serve the community for the long haul.
I was reading how involved they are too, these RKS groups. Like they're raising funds, advocating for patients, even making sure the quality of care is up to snuff. Talk about community engagement.
It's true, and it's a huge part of why this whole thing actually works, because it's not just a government thing or just a private sector thing. It's both, plus the community, everyone working together.
Well, and speaking of working together, it's worth pointing out that this whole 10-bed ICU thing wouldn't even exist without a ton of different groups all pulling in the same direction.
Right. You've got government agencies, NGOs, tech companies, philanthropists, even international organizations are involved.
Mm-hmm.
It really shows you what's possible when people collaborate.
Yeah, it's like a global effort with a really localized impact, which I think is what makes this program so cool. It's collaboration, it's innovation, it's about giving power back to the community, all
Yeah.
rolled into one.
And the best part, They're not keeping it a secret. They made their whole software platform, that care platform we were talking about, they made it open source. So other countries can use it, adapt it, use their tech to improve healthcare in their own communities.
Now, that's what I call leadership. They're not hoarding the knowledge, they're sharing it. Okay, so we've covered a lot here. We talked about the 5 core elements of 10-bed ICU, the equipment, the technology, the tele-ICU, the training, and of course that community involvement. We dug into the care platform, how it connects everything, how it fits into India's larger digital health strategy.
And we've seen how big this thing has gotten. Hundreds of ICUs, multiple states, countless lives impacted. Plus, we heard from doctors on the ground about how it's all playing out, saving lives, changing how healthcare happens in India.
Definitely gotten a sense of the positive here, and not just for India, but it wouldn't be a real deep dive if we didn't, flip the coin over, right? Look at both sides. Every project has its hiccups. What are some of the challenges 10-bed ICU has come up against?
That's a great point. I mean, just logistically, coordinating something this massive across 9 states, each with their own healthcare systems and infrastructure issues, it's a huge undertaking.
Yeah, I bet. And even within those states, making sure that everyone, even in remote villages, can actually get to these resources, that can't be easy. It's one thing to build an ICU, it's another to make sure people can actually use it.
And that's a big one. Bridging the digital divide. You got to have reliable internet access, people who know how to use and fix the tech. Those are all ongoing challenges for sure.
And then there's the human element too, right? Like
Yeah.
even with the best tech, the best training, it takes time to build trust, especially in communities who might have had not so great experiences with the healthcare system in the past.
Absolutely. That relationship, the patient-doctor relationship, the trust, that's not something technology can solve on its own. You got to approach it with sensitivity, cultural awareness, and really listen to what the community needs.
It does sound like 10-bed ICU is taking those challenges seriously, though.
Oh, for sure. And that's encouraging to see. Because even with all the bumps in the road, this program shows that real change, big change, it's doable. You just need people who can think big, who are really committed, and who are willing to adapt when things don't go according to plan.
And being open to new ideas, right? They've really shown that they're not afraid to experiment, to look for new ways to make things even better.
Absolutely. They are not slowing down. In fact, they're already working on some pretty cool new stuff.
Oh, yeah. Like what? Spill the tea?
Well, they're looking at bringing wearable sensors into the mix. Imagine integrating that data right into the care platform.
Whoa. Okay,
Yeah.
so they could track how patients are doing even after they leave the hospital.
Exactly. It's like instead of waiting for someone to get sick again or, hoping they come back for a checkup, you're getting all this real-time data, maybe even catching problems before they become a big deal.
That's amazing. And what were you saying about virtual reality?
Oh, right. So they're using VR for training, which is super cool. Creating these really immersive simulations so healthcare workers can practice stuff like complex procedures and stuff, but in a totally safe environment.
Makes sense. Like those flight simulators pilots use, right? Get all the practice without any risk to real patients.
Exactly. It's really pushing the envelope of what's possible in healthcare. But it always comes back to the human side of things. Technology is cool, but it's all about helping people at the end of the day.
Couldn't agree more. And that's what's so powerful about this 10-bed ICU thing. They could have just been like, look at our fancy tech.
Yeah.
But they never lost sight of the people this was meant to help, making sure people have access to the care they need no matter where they live.
Right. It's about empowering those communities, too.
Ah.
They're not just receiving help. They're part of the solution.
It's like a whole new way of approaching these kinds of problems. Like, even with the challenge as big as a critical care shortage, you can still come up with something that works.
And the coolest part is they're sharing it with the world. Open source platform. It shows you how committed they are to improving global health, not just in India.
Definitely. It's like this understanding that we're all in this together. That's how real, lasting change happens.
100%. So as we wrap this up, it's good to just take a second and reflect on what we've learned. We started with this 10-bed ICU program, learned where it came from, what kind of impact it's having, how it all works.
We dove into the tech, the training, those community partnerships, all the ingredients that make this program so special. And we talked about their challenges too, the things they've learned along the way.
We really went deep on this one. From the tiniest details to the big picture stuff, how can healthcare change for the better, not just in India, but everywhere?
We've given you all the pieces, now it's up to you.
Right. What did you connect with? What can you take away from this, use in your own life?
Maybe it's about finding ways to collaborate more, to be more innovative, to help lift each other up. Maybe it's about staying curious, staying engaged.
Whatever you do, hopefully this got you thinking, maybe even inspired you to go out and make a difference in your own way.
Because, at its heart, 10 Bed ICU is a story about what's possible. When people come together with compassion, with creativity, we can build a better world for everyone.